So we are live.
Good evening, everyone. Wishing you all a very happy 74th Independence Day to all the Indians and the Indian physiotherapists all over the globe. We welcome you all for the ExRx India's and Sri Samraj Services Private Limited presenting for the students, by the students web series powered by Fecal Studio, Chennai, Sairam Academy, Dusa Creations, West Bengal. Today, on 74th Independence Day, we have a globally renowned physiotherapist as a guest. He holds 3 PhD degree, worked as physio for Indian cricket team for 10 years, holds lots of awards from various organizations in the field of physiotherapy and other than physiotherapy also. And one among the award is Best Citizen of India Award in 2011. And he has memberships in various physiotherapy and sports organizations. He is none other than our Professor Ali Irani, presently working as a head of department in Nanavati Super Specialty Hospital, Mumbai, and he is a chairperson for International Affairs in Indian Association of Physiotherapy and also principal of NMIMS University. Before we go to the 176th topic, and we are having other guests also, Dr. Annie Thomas, principal of St. John's College of Physiotherapy, St. John's Medical College, Bengaluru, and we also having therapy. And I welcome all the three guests for today. Before we go to the 176th topic, I request Dr. and Professor Ali Irani to give a speech, especially for the students, to encourage them, because this is the first of its kind that students are presenting live session as a webinar session. So I want him to encourage the students. Sir, Ali Irani sir, please.
Good evening, everybody. My special thanks to Dr. Chandra Mohan and the team of ExRx India. Happy Independence Day to all of you all, and very good evening to all of you all. Thank you for your invite. My dear students, the ExRx India, whatever work it has been doing about having webinars and allowing the students to present their papers is going towards a world record. And I'm very hopeful that Chandra Mohan will achieve whatever he has been fighting for or wanting to achieve the world record as soon as possible. And I regularly attend this webinar. I've also told all my postgraduate students, we run a postgraduate institute under NMIMS University, Mumbai. And I've asked all my postgraduate students as and when Dr. Chandra Mohan will give them the time to present the papers with the same webinar. It is a way of learning. As we all know, from March when COVID has started, it all began. We were still at the conference in Chennai, our national congress in Chennai, and our biggest worry was whether government will put a ban on it or ask us to leave the conference or not to attend the conference or to postpone or cancel the conference. But somehow we started it on the 5th of March 2020 and we finished it on 8th March 2020. By that time, there were regular cases coming out of about COVID-19. And after that, we all know the lockdown started in the country. Neither any colleges could work, neither any exams could happen, nor any physical presence of physiotherapy students. In a way, all the university students. There were regularly University Grant Commission told all the colleges that physically the students should not attend the colleges, including the board schools. The schools also went on online classes. And I thought whatever I was seeing the girls, the students presenting, the physiotherapists presenting on this webinar, very informative, very informative. They were really carrying on whatever they had to do. It was very informative to me. And that's how I asked all my university students to present their cases, whatever they had. And I look forward for the best part of it was and discussing with Dr. Chandra Mohan was about that world record. Why not? Why not the word physiotherapy coming in the world record? And I'm really thankful to you and Dr. Chandra Mohan. I wish you all the best. Anything I can do from my side. I have been since the time I took over the international affairs. My fight was to get back Indian physiotherapists into the fold of WCPT, which is now called World Physiotherapy. World WCPT was World Confederation of Physical Therapy. So that word physical therapy was not matching all over the world, especially in India. Always physiotherapy was known, not physical therapy. So we fought that last when we were in Geneva in Switzerland, last World Congress. That was a decision taken that time and it was put to vote and it was voted that we will prefer calling ourselves World Physiotherapy rather than WCPT, which is World Confederation of Physical Therapy. So thank God, 1st August, we achieved it. And India is part and parcel of World Physiotherapy now. And the first Congress for this is going to be in Dubai in March, April. If situation arises, it will be a physical conference. If not, it will be an first online World Physiotherapy Congress. So I would request all the students who have presented here, they could send their papers to the World Physiotherapy. And if it is physical, there are lots. I know more than 100 physiotherapists from India who will be attending this conference in Dubai. I wish Chandra Mohan once again all the best. And please see that you get the world record. I'm wishing all the students all the best. Thank you. Thank you for calling me, Dr. Chandra Mohan.
Thank you, sir. Thank you so much, sir. We are humbled and we will call upon now Annie Thomas, madam. Dr. Annie Thomas, is she there? Check, please.
Yeah,
if she is getting disconnected, we will get.
Yeah, am I able to hear? Are you able to
Yes. I saw you left actually message. That's why.
Okay, the connection is a little poor here.
Yes, madam.
Yeah.
I request you to give us some encouraging words for the students, especially, madam.
Yes. Good evening, everyone. My resource person, Ali Rani sir, and all of you are attending this webinar section. A very happy Independence Day. Actually, it's a very proud moment for me today, actually. That too, a part of World Record webinar team. That too, the number is a big number, 175. Congratulations, Dr. Chandra Mohan, Dr. Rupesh, and Dr. Duna. You are doing a good teamwork. I'm very proud of you. And we are there are physiotherapy people who wanted to be achieved like this. It's a great thing, actually. And you people are already doing a great job because you're not only focusing on resource persons, actually, you're encouraging the students. So it's a very good thing. And I want to thank Dr. Ali Rani sir for making us being more proud of bringing us back to the WCPD team. It's a great thing for us, all of physiotherapists actually in India. Chandrasekhar, actually, we have our St. John's Medical College Department of Physiotherapy. It's in neonatal stage. If you say it started only in the year of 2016. I was working in some other college, but I later joined in St. John's Medical College. But you have given a good opportunity for all my students to showcase their knowledge. And many of them actually, I think in the classes, they don't even present this much, but that confidence and the thing they are explaining, no, it's like we all teachers are very happy about it. I think the same thing, the all college teachers must be feeling the same thing. I'm very proud of you people for bringing this platform for the students as well as for the resource persons. I wish you all the best. I know you can achieve it. All the best for you. We are with you. Okay, you can achieve. I'm wishing you Chandrasekhar, Rupesh, and Tuna, the entire team. And students, you are doing a good job. And most of your presentations I have seen in YouTube. Sometimes I cannot join in Zoom in, but I have seen it. And it was nice, actually. All college students are performing very nicely. The confidence which we are seeing in the UG students, especially, it's excellent. which we used to hesitate in our UG studies. So it's a good thing you're doing. Students, congratulations to the team. And thank you, Ali Rani sir, once more. Thank you, Chandra Mohan. All the best.
Unmute your mic, sir.
Thank you so much, madam. And really, your words are so much encouraging, especially for the UG student. Really, they are doing very good. Even the BPT first year student presenting about a simple muscle or bones, they are mesmerizing. And few participants, one among the participants, she presented 3 topics, full length video, not a slide, all the 3, whereas videos, and she played the video and she was giving the commentary, and it's very wonderful. And all the people who presented are mesmerizing. And every presenters, many college professors called me and said that really they are doing good. What you have said, they also said. Thank you, madam, once again. And now I call upon Dr. Vijay Selvan, Principal KMCT College from Kerala, to encourage the students.
Yeah. Good evening, everyone.
Please, sir.
Yeah. Good evening, everyone. And I wish you a happy Independence Day. And thank you, Chandramohan sir, Duna madam, and Rubesh sir, for your opportunity given to me to be a guest in this episode of By the Students and for the Students, which is doing a great job. And we have almost turned all the stones. We cannot say that any stones is unturned. So we have literally brought all the students, their didactic skills, their untamed things all into existence, and the students are really doing a wonderful job at this platform. So I have been telling to my faculty members to please watch the students take the seminar sessions, and because we are learning on every day. Even I learn every day through my students. I learn every day through all the webinars which has been keeping on held right from March 22nd till date. We are flushed with fully with the webinars, the whole month, whole series. Literally, if you take me, I get up, I sit in front of the system by 10 o'clock, and I wind up the sessions by 10 p.m. That is what my schedule been going on, except for the last month where I have taken some break of the sessions on and off. And I've been attending all these sessions which is conducted by your team, not through Zoom, of course, but I've been seeing it through online YouTube versions, and really it is amazing to see the students of this caliber level, their level of didactics, their level of enthusiasm, their level of innovation in presenting the things. It's really mesmerizing. I have seen 4 or 5 presentations from the students. It was very, above par. We cannot say on par. We can say that it is above par. As far we are concerned. So we have done a very good job in taming the untamed. The people who are all submissive, we have made them to come out, and the real talents has been shown by the students, and almost all the research person apart from the students whom you have organized. It was all wonderful topics, certain topics and all. We have not taken into consideration for a very long time. It is unseen islands. So those topics we have explored such islands through these webinar sessions, and I hope it goes on. I heard that this webinar session, webathon, is going to be a long marathon. Not only marathon is only for 42.1 kilometers, but this webathon is, I am praying Almighty to run all the way long. I heard that it is going to extend for another 1 month or 2 months. I don't know, we will beat the world record, I guess so, in the pace we are going. And I wish all the very best for the entire team, and please get it. Please get the record, which will be one of a kind for our physiotherapy team and the whole fraternity. And I thank Ali Ariana sir to have presided this function on behalf of the team. You have been a mentor for a very long time. See, I have completed my degree in 1997. And since then, I have been telling to my juniors, my students, you see Ali Irani sir in the Indian cricket team. I want you people to follow his footsteps, and you can very well be the next person in the team. That is how my students got inspired, and till now I am doing it. So I am very happy to have you in our sessions, and really I thank the whole team for doing a wonderful job, and to continue the same as long this COVID has taught us a lot of things. A lot of patience, a lot of things which we can explore. So I wish the team again on behalf of my college and behalf of Sairam Academy, and I wish everyone all the best. Please keep up the good job. And
Thank you, sir, and I agree with you.
Students, last but not the least, you are the ambassadors for us. So please keep going and keep yourself encouraged, keep yourself motivated. Nothing else can motivate us better than us. So keep ourselves motivated. Great going, students. All the best in all your future endeavors, and keep it as a stepping stone. And we will see many webinars and maybe many sessions. Might be in the next physiotherapy conference, students may be the resource person in the forthcoming conferences. So a great luck and great wishes for you people on this occasion. Thanks a lot. And again, happy Independence Day. Take care.
Thank you, Vijay. Thank you, Dr. Vijay. Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir, so much. I agree with you. Messages, even during night time, that I watched this students' session, it was really good. And this is really informative. I have never known, even the student is presenting. I agree with that, and I also agree with you that we are not going to stop when we finish the world record. It will continue. Our service will continue. At least monthly, twice or thrice, we will be having free webinars. And we, by this webinar, I found a lot of good hearts who come forward. They don't want money, just they want to share knowledge. We have a lot of good hearts here. So I hope so. We will find more good hearts also. And we will be continuing doing this webinar series. It's not a webathon, just to name it as, we call it as a webathon. Already we have completed 175, and today it is 176. Just to have a fancy name, we keep it like that. Webinar Super League, webinar Premier League, because we are missing the leagues, you know, IPL we are missing. So we had a webinar Premier League. That's how the names are related to sports. That's how we named it as a webathon. And really, it is not 42 topics in the session, more than 42 topics. And I thank you all. I wanted you all to be present till the end of this session. We will move on to the topic. ExRxIndia's 176th topic is Sciatica, symptom or pathology. Will be presented by Mr. R.Edward Thainess, Durai. Now I welcome Mr. Edward to share the screen and slide and commence the session, please.
Can I share the slide, ma'am?
Yes, Edward, yes.
Thank you. Is it visible, sir?
Yes.
Yes. Yes.
Yeah.
It is visible?
Can I start, sir?
Yeah, please start. Please continue.
A very warm and a pleasant good evening to one and all. First of all, I like to thank ExRxIndia for this organizing this great event for the student and by the students. And I also like to thank my heartfelt thankness towards Mr. Chandramohan sir, Mr. Rupesh sir, Ms. Duna ma'am, and my special thank you to the honorable chief guests who are in the presence of this great Independence Day, and Dr. Ali Hirani sir, and Vijay sir, and Annie Thomas ma'am. So thank you for a great presence, and I feel very much glad to take my webinar session in front of this great peoples. And first of all, I like to introduce myself in behalf of you. And I'm R.Edward Thainess Durai. I'm studying BPT first year in Dr. MGR Educational Research Institute, ACIS Medical College and Hospital, Chennai. I feel very blessed and glad to present my webinar topic in front of you all. And the topic which I've chosen for this webinar session is sciatica, a symptom or a pathology. It is very much interesting topic. I hope everyone will become interested and get some knowledge at the end of a session. Let's move into the webinar and the presentation. And the contents which I'm going to deliver and share in this webinar is all about the intro, the types, the causes, the symptoms, the various diagnosis of the treatment or conclusion. The first thing we are going to see about what is sciatica. First of all, sciatica is a condition or a pain which is occurred in the lower back or a thigh region. How the pain causes, we must have to know what is the reason behind this. The main and the major reason behind this sciatica, it's mainly due to the compression or the irritation of a sciatic nerve. So hence the pain, it also named as sciatica. So everyone, before we know about what is sciatica, we must have to know what is sciatic nerve. Yes, so sciatic nerve is one of the longest and widest nerve in our body, and it is supplied by 5 different nerve supply. I request everyone to see the picture which I've attached along with the slide. You can see the different spinal nerves like L4, L5, S1, S2, and S3. And these are the 5 different nerve roots which is supplied by the sciatic nerve. And now we are going to see how these different nerve supply, which is travel to the sacrum and divide into 2 major divisions. First of all, these 5 different nerve roots like L4, L5, S1, S2, and except S3, it divide into 2 different divisions like anterior division and posterior division. When come to the anterior division, this L4, L5, S1, and S2 will result in the formation of tibial nerve. So, and when come to the posterior division as an anterior also, these L4, L5, S1, S2 nerve, which result in the formation of common fibular nerve. So these nerve roots are the main reason for the formation of 2 important branches of sciatic nerve. It's nothing but the tibial nerve and the common fibular nerve. These 2 nerves are joined together by a fibrous connective tissue and result in the sciatic nerve. And next thing we are going to see how these different 3 nerves are supplying what are all the regions in our body. First of all, we may know that this sciatic nerve which innervates the muscles of back of a thigh region. Obviously, it is mostly it innervates the muscles of the back of a thigh region. But when come to these 2 nerves, they are branches like tibial nerve and common fibular nerve will supply different parts of the leg and different compartment also. First, we are going to know about the tibial nerve. The tibial nerve, it supplies the posterior compartment of the leg and also to the intrinsic flexus. So when come to the common fibular nerve, it supplies the anterior compartment and the lateral compartment of the leg and also the intrinsic extensors. So these are all the nerves which is supplied to the different regions of the leg. So these are all the overall information about the sciatic nerve. And next we move into our main topic, and the second content of the session is types of sciatica. Normally, when come to the types of sciatica, we have different types. But now we are going to learn about only 2 types. The first thing is about neurogenic sciatica and second type is referred sciatica. So what is neurogenic sciatica? Normally, the neurogenic sciatica, it is caused by the compression of a sciatic nerve roots. So now I'm going to ask you everyone to see the picture which I've attached to the slide. You can see how the normal disc is present and how the degenerative disc, and you can see the bulging disc, the herniated and the thinning disc. So these are all the various conditions and the various reasons of that neurogenic type of sciatica. So in normally, we know how the sciatica is caused. It causes only by the compression or it may be due to some irritation. But when come to the neurogenic sciatica, it may be it has contained several reasons like bulging of an intervertebral disc, or it may be due to some herniation or degeneration also. And next types is all about referred sciatica. So when come to the referred sciatica, this type of sciatica, it is only result, it's due to the any injury or any damage to the muscle or a joint problem with these muscle and joint must related and situated in the spine and pelvis alone. So it's obviously it can mimic a sciatica and it result in pain. So and also everyone have to note that these both neurogenic sciatica and referred sciatica as a result certain abnormal neurological findings. It may, we can say examples like loss of sensation, or we can also say loss of reflexes and sensory changes also. So these are all the two types of sciatica. The one thing is neurogenic and next thing is the all about referred sciatica. And we come to the very important content and very important subtopic of this sciatica is the causes of sciatica. First of all, you may know that I already told that sciatica is a pain which is occurred. The main causes the irritation or the compression of sciatic nerve. But now they have divided the causes into two different aspects, like spinal and non-spinal. How it affects a spinal when there is what are not causes and when come to non-spinal. So at the end of these causes, you can able to differ between the spinal causes and also the non-spinal causes. The first thing is about spinal causes. First of all, this spinal causes is often related to the spinal column only. The most familiar example or the familiar one we may all know, it's nothing but intervertebral disc herniation. Before we know about the herniation, we must have to know what is intervertebral disc. So these intervertebral discs are present in between the vertebra, likewise in between the intervertebral column. And what is a major function? The major function of this intervertebral disc is nothing but it can act as a shock absorbers. And next thing we are going to see, what are the types of intervertebral disc? First of all, you can see the picture which I've attached. You can able to see clearly the outer part of intervertebral disc is called annular fibrosis and the innermost part is called nucleus pulposus. So these are all the major two parts of the intervertebral disc. Then how herniation is caused? Herniation is caused due to three major reasons. That is the poor posture. The poor posture can be occurred while we are sitting or lying down, or we can spending lots of time in work or IT companies. We can work lots. At this condition, we may get some poor posture. And second things, trauma and rotational movement. These three are the major reason for the herniation. After herniation, what will happen? You can see the picture clearly. You can see the bulging out of one side of the intervertebral disc. It can compress the nerve root and it leads to the herniation. So when come to intervertebral disc herniation, these three are the first reason. And there is also a second reason for this herniation. You know, the inner part of this intervertebral disc herniation, intervertebral disc, it's nucleus pulposus. We may all know about the immune cells like macrophages. When come to the macrophages, these macrophages will directly attack to the innermost part of this nucleus pulposus. And finally, it results to major things. The one is called inflammation and another is called swelling. So because of these two, like inflammation and swelling, it lead to intervertebral disc herniation. So we have to be very clear that intervertebral disc herniation can occur mainly due to two main reasons. The first reason, as I have told, it may due to some poor posture or it may have some rotational movement. And second major reason, there is a macrophages which is directly attack to the nuclear pulposus. Yes. And second causes we are going to see about the spinal stenosis. What is spinal stenosis? Spinal stenosis is nothing but it is a narrowing of a spinal column. So due to this, the spinal column, the intervertebral foramen become narrowed. How it become narrowed? It may due to certain reasons. Yes. The first reason is degenerative bone disorders. And second thing is about trauma. And third thing is inflammatory disease. We can say the example of inflammatory disease as rheumatoid arthritis. So due to these disorders and disease condition, the intervertebral foramen can become narrowed. And this cause is known as the spinal stenosis. Yes. And the third and the most important cause we may all know is spondylolithisis. First of all, What is mean by spondylolithisis? You can see the clearly now. The spondylolithisis is nothing but slipping or displacement of the vertebra forward. You can see the picture. So spondylolithisis is occurred, and its major thing is going to be happen. It's a vertebra. It become displaced or slip forward. It may also due to certain trauma when performing certain surgery in the spinal column. The patients will suffer these type of causes called spondylolithisis. In down, you can see how these spondylolithisis can be transformed from normal stage to the highly stipple stage. You can see first the normal spine, and then there's a 4 grades of in there in the spondylolithisis. In the first grade, you can see how the variation is occur in each and every grade, and finally the vertebra get displaced. So this is a main reason for the spondylolithisis. And there is also certain other causes we may have to make a note of it. The first thing is about sacroiliac joint disinfection. First of all, the SI joint, the sacroiliac joint, where it present in between the sacrum and the pelvis. Normally, this sciatic nerve will passes to this sacroiliac joint. So when there is a joint dislocation, or when there is any damage or injury to this sacroiliac joint, will directly lead to the compression of a nerve roots and lead to sciatica. And next thing is about the growth factors. In growth factors, we can say example like formation of cyst or abscesses. So due to these conditions, it result in the compression of a nerve roots. Yes. And finally, degenerative joint diseases. What we can say degenerative joint diseases, like for example, arthritis. When come to arthritis, there is lots of types of arthritis. Due to this all condition, it will finally lead to the compression of a nerve roots. So these are all the spinal causes. And next, we are going to see about the non-spinal causes. Before we enter into these non-spinal causes, we must have to be very clear what is the difference between the spinal causes and non-spinal causes. Obviously, while we are seeing the back of a slide, you may get understood that spinal causes, it's occurred in the spinal column. But when come to the non-spinal causes, it will occur only outside of a spinal column. At this condition, it will attack the sciatic nerve itself. After seeing the example of this non-spinal causes, at the end, you can able to differ between the spinal and the non-spinal. The first, we are going to see about the piriformis syndrome. What is a piriformis syndrome? Before we know about the piriformis syndrome, we must have to know where it's situated. Now you see the picture clearly. You can see that the piriformis syndrome, you can see the piriformis muscle, it's situated very much close to the sciatic nerve. So when there is a muscular inflammation or when there is a muscular spasm, it will automatically lead to the compression of a sciatic nerve, and finally it lead to the sciatica. So you can able to see this is the piriformis muscle. So when there is a muscular inflammation or the muscular spasm occur in the piriformis muscle, it will directly lead to the compression of a sciatic nerve. So it is one of the non-spinal causes. Yes. And next non-spinal causes we are going to see, it's very much interesting for all of us. It's nothing but vallet sciatica. It is also known as credit carditis. In this world, everyone, including me, we are having our wallet at the back of the packet, and we are going every places. So when during sitting postures, we may all know that in our wallet we may have lots of our personal items, ATM cards and many cards. And whenever we are sitting, that is during sitting posture, this wallet will put certain pressure on the gluteal muscle. Only the gluteal muscles like gluteus maximus, or it may be gluteal minimus or medius. At this condition will directly lead to the compression of a sciatic nerve. So you can able to clear one thing. When we are discussing about a spinal causes, it is a direct attack. But when we are discussing about a non-spinal cause, it's indirectly compressing a nerve roots and lead to the sciatica. So please make a note of it and clear of that. So it is all about vallet sciatica, or it is also known as credit carditis. And next thing is about pregnancy. What is a pregnancy? We may all know the women which carrying a fetus for 10 months at the 3rd trimester. So during a 3rd trimester time, the head of the fetus will be shifted. shifting of head of the fetus will occur in the 3rd trimester. So at this condition, you may see the head of the fetus will put certain pressure on the sciatic nerve. Obviously, the sciatic nerve is present very much close to the fetus head. So when there is a shifting of a fetus head during a 3rd trimester, it will put certain pressure and it lead to the compression of a nerve roots, and it's one of a non-spinal causes. And other causes may have like trauma to legs, and also there is a pelvic tumors, and also due to fractures or infection. We are completing about the what are all the causes of a sciatica. So I like to say one thing. You can able to differ that what is spinal and what is non-spinal. When come to spinal, it is a directly it will result, but when come to non-spinal, it indirectly result, like a piriformis syndrome or valid sciatica or during pregnancy also. So these are all the different causes we may have seen. And next, we are going to see about the symptoms. Symptoms are very, very much essential. We must have to know about this. Obviously, when there is sciatica, the first foremost symptom is aching and sharp leg pain. And there is also numbness, burning or prickling sensation, and inability to bring the foot forward. And there's a lot of symptoms. But because before we know about the symptom, we must have to know very important one. The first thing, each symptom, the causes, the treatment, it's vary from one person to the another person. Like it depends upon the various factors. Like it depends upon the location of the pain, and it depends upon the cause, and it depends upon the each individual also. The symptoms and the treatments so vary from one person to the another person. And it is very much essential to know where it's located, where the pain mainly locates. The pain mainly locates in the buttock region, back of a thigh, back and outside of the calf, and foot and toes. We obviously know the sciatic nerve which travels from the back of a thigh region, and it will move down towards the foot. So these are all the 4 major locations of a sciatic nerve. And next, we are going to see about the quad equina syndrome. You may all become doubt why I'm including this quad equina syndrome in between of sciatica. Yes, obviously, in rare condition, the patients with sciatica is often experience this quad equina syndrome. I'm not going to elaborate this, but I'm going to say briefly about this quad equina syndrome. So the people's having a suffering from sciatica, it will experience a loss of bowel or a bladder control, or it may also they have experienced a progressive weakness, and also the loss of sensation in their legs. So this is also known as quad equina syndrome. You can clearly see the picture which I have attached along with the slide. First, you see the normal intervertebral disc and how it has been modified from 2nd stage and finally to the 3rd stage, how it become inflamed, and it is also due to lots of different reasons. So rarely the patients or the persons who are suffering from sciatica was often experiencing this quad equina syndrome. Yes. And we come to the diagnosis. Before we enter into the diagnosis, we may all know that whatever the disease, whatever the conditions, it may be sciatica or it may be any other condition, there is only 2 types of treatment. First is surgical and second one is non-surgical. But when come to the sciatica, 85% it's only necessary or only recommended is non-surgical. But if the patients or they can't able to relieve from the pain, or they're still suffering a lot, whether it is in a severe conditions only, certain peoples are undergoing surgical treatment. So first in this diagnosis process, we are going to see about a surgical treatment. Yes, first in surgical treatment, we are going to see about microdiscectomy. First of all, what is stomy? Stomy is nothing but a removal. So in this surgical treatment, there is a surgical removal of part of a disc which creating a pressure on the nerve. So we are going to remove surgically, we are going to remove the part of intervertebral disc which creates pressure on a nerve. So when we are removing this, the rest of the disc will be untouched, so we can able to prevent the pain also. So it is one of the major surgical treatment which it is mostly recommended to the patients. And the next thing is about laminectomy. What is about laminectomy? And it is also a surgical removal, as a not a full complete part of intervertebral disc. We are going to remove the small portion of a bone or a disc material that is pinching the nerve root is removed. So when we are removing this, we get a good results. Like we can able to allow some extra space between the vertebra and the pressure on the nerve is reduced. So in this both technique, when come to microdiscectomy or laminectomy, we are reducing the pressure on the nerve. When come to the microdiscectomy, we are going to remove the disc, so the pressure on the nerves can be reduced. When come to laminectomy, we are going to remove the bone or disc material, so the pressure on the nerve can also become reduced. And the third surgical treatment, we are going to see about a spinal fusion. First of all, what is known about fusion? In physics, you may learn about a fusion or the fission. Obviously, fusion is fusing together of the two substances or the particles. But when come to the fission, we are splitting or breaking tiny particles from a large molecules. Yeah. So in spinal fission, what we are going to fuse? We are going to fuse the vertebra. So the vertebra above and below the injured disc are fused together. So when we are fusing together these injured disc and the vertebra, we can able to prevent the movement, and we can able to help the person who suffering from this. Now you can see how the rods and screws are placed and fuse with the help of the rods and screws. They have fused the vertebra in between, and you can also see how the anterior lumbar spinal fusion has been taking place. So it is one of the main and major surgical treatment. And next surgical treatment is obviously disc replacement. But not only when come to sciatica, if there is a hip or it may be due to some nerve injuries or nerve dislocations also, we are very much prefer to the replacement. Likewise, we are going to replace the intervertebral disc. So when come to the surgical removal, we are not going to replace anything. But when come to disc replacement, we are going to replace with an artificial disc. You can see clearly how the lumbar artificial disc replacement has been taking place. And in this recent time, there's a many research and many inventions are going on this, how to create and how to make artificial disc. We may also use like CAD 3D printing. So many scientists have been and many researchers are researching a lot for this topic with the use of a CAD 3D printing or any other sources. They can able to create our bone material itself with the machine. So with the help of a certain surgeons or with the help of a certain peoples, we can able to create our own bone and we can able to implant them. So this is very much essential in a research point of view. Yes. And next we are going to see about a non-surgical treatment. I already told this non-surgical treatment is very, very much essential for the patients who are suffering from sciatica. The first, and it also includes certain classical physical examination. The first is about straight leg rise test. It is also known as Lassiger's sign. So the treatment is called SLR treatment. That is nothing but straight leg rise treatment. What is going to be done here? So listen everyone, the patient will be lie down on the bench, and the examiner will lift the patient's leg upward. It will lift upward. At this condition, when there is an angle, we may get the angle at this condition like this. Like this, we may get the angle like this. So at the condition of the angle of 30 degree and a 70 degree, and patients who are lying down is accumulating, or they can be able to get more pain at this condition. At this condition, the test is positive. So when there is a lifting of a leg, when there is a rising of the leg condition, if the patient is suffering or if the patient is experiencing severe pain when there is a lifting movement, the test is positive. And so to check whether it's a positive or negative, the examiner will done this check to check whether it is a positive. So after the straight leg test, the patient and it must have to be recommended for the CT scanning or MRI scanning is very much essential for this. So it is one of the very familiar and very much essential non-surgical treatment which is practiced by several people, and chiropractors are the ones who have been treating this sciatica for often. And next, there is a lot of other treatment. Before we know about the lots of other treatments, I like to say one thing. I'm already told when come to symptom or when come to certain treatment, it may often differ from patient to patient. So if the person who's suffering from sciatica, they can use certain pain medications or anti-inflammatories. So when they're using, they can be relieve the pain during a short period of time. But some people will experiencing a pain for long duration. So it may be differ from patient to patient. And there is also massage, dry needling, acupuncture. Exercise is very much essential for this, and transducated nerve stimulation, electrical nerve stimulation. We often know that what is the main cause of sciatica? It is a compression of a nerve roots. When we are using a TENS, it is very much we can able to cure the patient as soon as possible by electrical nerve stimulation. So these are all the very, very important non-surgical treatment we may have to know. Before we come to the end of a session, I like to say certain facts about the sciatica. The one thing is about the sciatica is about unilateral condition and the bilateral condition. When come to unilateral condition, you may have to know what is unilateral condition. The pain occurred only in a one, like a only one leg can be pain is suffering. But when in certain cases, bilateral condition can also be occur. When the cases can occur, for example, when during a central disc herniation, or it may due to lumbar stenosis. At this condition, bilateral condition can also be occur, and the persons can also be suffering from knee jerk reflex and ankle jerk reflex also. So these are all the overall view of sciatica. And before I end my session with a quick recap, I like to I like to brush up a topic with a quick 1 minute. So first of all, the sciatica is nothing but a pain or a condition which may arising due to the compression or the irritation of a sciatic nerve. And we see about what is about sciatic nerve. It's one of the longest and the widest nerve supply, and we may have to make a note of it, the entire 5 different nerve supplies, and it's very much essential for splitting and for the different compartments of the leg. And next we see about the types. First is neurogenic and second is referred. And we have go through the causes. When come to spinal, the very, very important is intervertebral disc herniation we have seen, and spondylolithisis we have seen. And when come to non-spinal, the piriformis syndrome, the valid sciatica, and also during pregnancy condition. And symptom, one of the major symptoms is aching and sharp leg pain. The person who's suffering can't able to lift their leg forward. So these are all the important symptoms we may have to know. And we have seen the treatment, obviously the surgical and non-surgical. In surgical, we have seen the surgical removal like microdiscectomy, or it may have a laminodiscectomy. And there is also non-surgical like classical physical examination like SLR test, nothing but straight leg rise test, and also certain other treatments. So these are all the overall view of sciatica. I hope I explain this topic is very much essential. And finally, we come to the conclusion of my session in the topic of sciatica, a symptom or a pathology. Obviously, physiotherapy is always recommended as a first line treatment for the patient with sciatica. So I'm very much happy and very much glad to taking part of this session and taking this session in front of the great peoples. So thank you for this wonderful opportunity. And once again, I thank ExRxIndia and giving me this wonderful opportunity, since I'm a first year student with a lot of fears and a lot of desires. I've came here, and thank you for giving this wonderful opportunity. And I'm looking for great events from you. So thank you, everyone. Thank you for your patience who have been seen in our YouTube and Zoom. Thank you for your patience. And finally, last but not least, I'm very much needed your feedbacks, because your feedbacks help me a lot for the upcoming works. And thank you. And my happy Independence Day wishes to everyone. This Independence Day I would never forget, because thank you for making my day so special to take this webinar session. So thank you, everyone. Thank you so much, everyone. Thank you.
Thank you, Mr. Edward. Actually, we have to check your ID proof, I think. You don't seem like a first year student. I was thinking like you must be a lecturer in a college. Very well taken. That not only we made your day, you made our day actually. That is the true thing. Okay.
Thank you.
We don't know anything about you except that you are a physiotherapy student. But you made our day very much wonderful. Okay.
Thank you.
And the way you take the class, it was amazing, really. I would like to call upon our Professor Ali Irani to have a feedback of this session also. And next, then our madam, and then Vijay Selvan, sir. Please, sir, Ali Rani, sir.
Edward, excellent.
Thank you.
Excellent.
Thank you so much, sir.
I feel so well defined lumbar vertebra, so well defined.
Thank you, sir.
I have been asking and thinking about again your qualification and which year. Very difficult to digest a first year physiotherapy student talking on sciatica in such a way and such in depth of it. Right? Almost you have left nothing for anybody else to say on a lecture on sciatica. Thank whoever has helped you, or if you have gone and searched everything on it. And I could only say congratulations and may God give you a healing hand. The way you present it, if you're going to see a patient also that way, I'm definitely there will be long queues outside your clinic whenever you start. I wish you all the best and God bless. And Chandramohan, thank you for giving lovely opportunities for such lectures to come up.
Please stay with us. Please
Unbelievable.
stay with us for another 2 or 3 minutes. Just we will go call Dr. Annie Thomas from St. John's Medical College to give her the feedback regarding the student. And 1 more minute for our Dr. Vijay Selvan. Then we will conclude the session immediately. Madam, Dr. Annie Thomas, madam, please.
Yes. Can you hear me?
Yes, madam.
Yes.
Yes. Durai, I don't know. As Chandra Mohan said, I am doubtful whether you're a first year student or not. Okay, it was a wonderful presentation, really. And I know you must be studying only anatomy, physiology, biomechanics. But the way you took the class, you're already finished 4th year like that. It was a wonderful thing, and I think you might have taken help from your lectures. Wonderful thing they also have done to you, and the eagerness to cover up everything. You could have finished only anatomy and biomechanics, but you are covered entirely. It's a very good thing, and literally I think it was refreshing for us also. A great fortune is waiting for you, as Ali Rani sir said. The people will be waiting for you. I think he only can give an opportunity as a sports physiotherapist in future.
Thank you.
I think your aim is also for that. The way the presentation goes, it's like that. I think your aim is to be a sports physiotherapist. I think so. All the best. Okay.
Thank you.
Do well. Not only in first year, till 4th year, you should be like that, even in your PG and PhD. All the best.
Yes, sure. Thank you so much.
Thank you,
Thank
Chandra Mohan.
you, madam. Let us move on to Dr. Vijay Selvan now. Sir, please
Edward.
take a minute and give your feedback, sir, please.
Yeah, Edward, you just rocked the floor. And I was just having a doubt right from the beginning whether you belong to MPT first year or second year batch of Dr. MGR Education and Research Institute, because that was the first institution where I started my academic profile in 2003. I was working there till 2011, and I quit from there and I joined here in Kozhikode. And I was amused by the facts. I just saw some messages that you belong to first year BPT. I don't know how on earth you could do so well. Your transition from one slide to another slide was so smooth. I just can't say anything. Even I will say it openly. Even my faculty members, every month I am conducting a faculty meet regarding they should take a session for all the faculty members, including me. Every month end, it is their responsibility that all the faculty members should take a session from for the faculty members, not for the students, but for the faculty members and for the HOD or the principal, whoever it is. Okay. And I have been here in this academic field for the past 14, 15 years. And I have never seen any single faculty member present in such a way, so smooth transition from slide 1 to slide 50. in such a good manner. I have not seen anyone. And upon all that, you are just a first year BPT. That is what is making me frown. My corrugator superciliary is working 24 hours right now. my corrugator superciliary, you know, that is a frowning muscle. It is working a lot right now in the first half an hour, and I'm getting goose pimples. Like Ali Rani sir says, I'm getting goose pimples. Kudos to you, Edward, and you have got long way to go. And if you have any chance of migrating from Chennai to Kozhikode, please come to my college. I will, make you as my student, and I will give you a moratorium and scholarship for your whole period of study.
Thank
Okay.
you so much. Thank you.
Okay, and God bless you, my child, and I am really grateful for all your teachers who have helped you. As Ali Rani sir told, I really don't know whether the teachers have helped you or you yourself have gathered all the information I have put into slides. I am still not into a conclusion. Okay, really, I was amused. A smooth transition. I hope everyone will agree. From slide 1 to the last slide, there was not a single phase of pause. It was a smooth transition. There was no crust and rough. It was just a smooth transition, linear way of transition. I really appreciate you, Edward. You have a long way to go. God has given you so much of a talent. Please utilize it well. Whichever field you're interested in, no matter whether in musculoskeleton or sports or cardio or neuro, it's up to you to decide upon, which you should decide at the end of your BPT, 4th year. Okay. The decision made in 1st year will not be apt to carry on with the 4th year. At the end of your 4th year, whichever you feel apt to you please pursue it accordingly. Any help, you can get my number from Chandrabhavan sir. Any help you need regarding the academics, I'm here to help you day and night. Not at all an issue. Chandrabhavan sir, I'm really mind blocked with this fellow.
Thank you, sir. This is like a talent hunting show.
Please don't leave any stones unturned. Okay.
No, sir. No.
That is what I meant in the inaugural speech. What I said to you. It was really awesome, Edward. God bless you.
Thank you. Thank you so
Keep
much.
up the good work. And Ali Rani sir, I have never seen Ali Rani sir smile so much for the entire 5 minutes in my whole career, during his speech or during his conference. And today I'm seeing him smiling for the past 10 minutes with joy. It is not a smile, it is a joy to have such students. It is just an ultimate joy to have such students.
Dr. Vijay is excellent. He should be taking the same lecture for IAP YouTube for all the years.
Yeah, see the way of appreciation you get. Ali Rani sir is a legend. I have told you already. I finished in 1997. I have been looking upon him as my mentor, and I have been telling my students, see Ali Rani sir on the field. I want you people to be the same in your future. Okay. I'm really, today's day was made a lot by the whole team of Chandramohan sir, Duna madam, Rupesh sir, and especially with the chief guest, Ali Rani sir and Annie Thomas madam, who has come all the way from Bangalore. I'm really, I don't know what else to tell about this session.
Thank you, sir. Thank you so much for the feedback and encouraging words to the student, actually.
Yeah.
Whoever asked for the help, and to you, not only to you, all the physiotherapists I have known. So there is no way that I will let stone to turn any side. Okay, we won't let any stone to turn. Okay, so we will be concluding this session. I call upon Ms. Rutwa. Is Ms. Rutwa there?
Yes, sir.
Can I take your
Please,
leave, Dr.
please,
Chandramohan?
Yes, sir. We are finishing, sir. We are concluding now. Please.
After.
Yes.
Thank you.
Ritwa?
Audible?
Yeah.
Yes. Please conclude the session.
Yes. Hello everyone. Good evening. Myself Rutwa Pandya, final year student from Gujarat. I'm very happy to have this opportunity to thank a wonderful person, Dr. Ali Irani sir, who is chairperson of Indian Association of Physiotherapists, head of Department of Physiotherapy and Sports Medicine and Rehabilitation Center, and principal of NMIMS University, who have great experience of various physiotherapy and medical colleges, physiotherapist for Indian cricket team, PhD guide and researcher at Bombay Hospital, and so on, and achieve awards like HITRA Oration, Lifetime Achievement Award by Indian Association of Physiotherapy, Best Citizen of India Award 2011, and Best Physiotherapist Award in 2014. Thank you so much for joining the For the Student by the Student program and encourage us by your motivational words. We feel happy and blessed to have you. Thank you, sir, and thank you, Team ExRx India, to give me this opportunity. Over to you, Dr. Chandramohan, sir. Thank you.
Yes, and I would like to thank Dr. Annie Thomas from St. John's Medical College, Department of Physiotherapy, and Dr. Vijay Selvan from KMCT College of Physiotherapy, Kozhikode, Kerala, and our resource person, Mr. R.Edward Thainess, Durai, from Dr. MGR Educational and Research Institute, ACS Medical College and Hospital, and all the professors, principal of the same college. Thank you so much. Thank you all the participants joining with us. Wish you all a very happy Independence Day. And advance all Physiotherapy Day wishes to our Ali Irani sir and all other guests. Thank you, sir.
Thank you so much, sir. Thank you.
God bless. Edward, rock.
Thank you, sir. Thank you so much.
If you open a clinic only for sciatica, you will mint. You don't need to study any more physiotherapy.
Thank you so much. Means a lot, sir. Thank you so much. Thank you.
God bless you. Whenever in Mumbai, please welcome.
Thank you. Sure. Thank you so much, sir.
God bless.
Thank you, sir.
Bye-bye.
Thank you all. Bye-bye.